Cancer has long been one of the most formidable challenges in modern medicine. For decades, treatment options were largely limited to surgery, chemotherapy, and radiation therapy, each with its own set of physical and emotional tolls. While these approaches have saved countless lives, they often come with significant drawbacks, including invasive procedures, debilitating side effects, and uncertain outcomes. However, recent advancements in cancer research are beginning to shift the paradigm, offering new hope to patients who once faced grim prognoses. One such breakthrough involves a groundbreaking approach that leverages the body's immune system to target and eliminate tumors, particularly those with a specific genetic mutation. This innovation not only promises to improve survival rates but also to spare patients from the harsh realities of traditional treatments. At the heart of this discovery lies an understanding of a particular genetic mutation known as mismatch repair deficiency. This mutation disrupts a critical process within the body's cells. Every time a cell divides, its DNA is copied, and errors inevitably occur during this replication. Normally, a mechanism known as mismatch repair corrects these errors, ensuring the integrity of the genetic code. However, in tumors with mismatch repair deficiency, this repair system is shut down. Without it, mutations accumulate rapidly, giving the cancer a survival advantage and enabling it to grow unchecked. This mutation is commonly found in several types of cancers, including colorectal, gastric, pancreatic, and endometrial malignancies. While mismatch repair deficiency was once seen as a hallmark of aggressive cancers, researchers have now turned this characteristic into a vulnerability that can be exploited for treatment. The turning point came with the development of a novel immunotherapy drug designed specifically to target tumors with mismatch repair deficiency. Unlike traditional therapies that directly attack cancer cells, this approach works by reprogramming the immune system. The drug essentially exposes the tumor to the immune system, making it appear foreign and dangerous. Once recognized as an invader, the immune system mounts a powerful response, attacking and eliminating the cancerous cells. This strategy represents a significant departure from conventional treatments, which often rely on external interventions like surgery or toxic chemicals. Instead, it harnesses the body's natural defenses, offering a more precise and potentially less harmful method of eradicating cancer. Clinical trials exploring this immunotherapy have yielded remarkable results. In a study involving patients whose tumors exhibited mismatch repair deficiency, the experimental treatment proved highly effective. A substantial majority of participants experienced complete remission, with their tumors disappearing entirely without the need for surgery. These findings have far-reaching implications, suggesting that a significant portion of patients with this specific mutation could avoid the trauma and complications associated with invasive procedures. Moreover, the success rate observed in the trial underscores the potential of immunotherapy as a game-changing tool in the fight against cancer. One of the most compelling aspects of this breakthrough is its ability to preserve the quality of life for patients. Traditional treatments often leave individuals grappling with severe side effects, ranging from nausea and fatigue to permanent disabilities. For example, surgeries to remove parts of vital organs like the esophagus or stomach can drastically alter a person's ability to eat, speak, or engage in daily activities. Immunotherapy, on the other hand, offers a less invasive alternative that allows patients to maintain their normal routines while undergoing treatment. This aspect cannot be overstated, as it addresses not only the physical burden of cancer but also the emotional and psychological toll it takes on individuals and their families. The implications of this discovery extend beyond the immediate benefits for patients. It highlights the growing importance of precision medicine, a field that tailors treatments to the unique genetic characteristics of each patient's cancer. By identifying tumors with mismatch repair deficiency, doctors can now determine which individuals are most likely to respond to immunotherapy. This targeted approach ensures that patients receive the most effective treatment available, minimizing unnecessary exposure to therapies that may not work for their specific condition. Furthermore, it sets a precedent for future research, encouraging scientists to explore similar vulnerabilities in other types of cancer. As the field of genetics continues to evolve, it is likely that more mutations will be identified and leveraged for therapeutic purposes, paving the way for even more personalized and effective treatments. Another significant advantage of this breakthrough is its potential to reduce healthcare costs. Traditional cancer treatments, particularly surgeries and prolonged chemotherapy regimens, can be financially burdensome for patients and healthcare systems alike. By eliminating the need for invasive procedures in many cases, immunotherapy could lead to substantial savings. Additionally, shorter treatment durations and fewer complications translate to reduced hospital stays and follow-up care, further alleviating the economic strain on both individuals and institutions. This financial benefit is particularly important in an era where healthcare accessibility remains a pressing global issue. Despite the promising results, there are still challenges to overcome before this approach becomes widely available. One concern is the need for universal testing to identify tumors with mismatch repair deficiency. Currently, not all patients undergo genetic screening as part of their diagnostic process, meaning that many eligible individuals may miss out on this life-saving treatment. Advocates are calling for routine testing to become standard practice, ensuring that no one is left behind due to a lack of awareness or resources. Additionally, further research is needed to understand why some patients do not respond to immunotherapy despite having the mutation. Addressing these gaps will be crucial to maximizing the impact of this breakthrough and ensuring equitable access to its benefits. Looking ahead, the potential applications of this discovery are vast. While the initial focus has been on gastrointestinal cancers, mismatch repair deficiency is also present in other malignancies, suggesting that immunotherapy could be effective across a broader spectrum of diseases. Researchers are already exploring ways to adapt this approach for use in other types of cancer, as well as investigating combination therapies that pair immunotherapy with existing treatments. Such combinations could enhance the effectiveness of both approaches, providing even better outcomes for patients. Furthermore, ongoing studies aim to refine the drug itself, making it more potent and reducing the likelihood of resistance developing over time. Beyond the scientific and medical implications, this breakthrough carries profound emotional significance for patients and their loved ones. A cancer diagnosis is often accompanied by feelings of fear, uncertainty, and helplessness. Knowing that there is a treatment option that not only offers a high chance of success but also preserves one's quality of life can be incredibly empowering. For many, it represents a renewed sense of hope and the possibility of reclaiming their lives from the grip of illness. Stories of recovery serve as powerful reminders of what is possible when science and compassion intersect, inspiring others to remain optimistic in the face of adversity. The success of this immunotherapy also underscores the importance of continued investment in cancer research. Advances like this would not be possible without the dedication of scientists, clinicians, and funding organizations committed to unraveling the complexities of the disease. Governments, private institutions, and philanthropic efforts must continue to prioritize research initiatives that push the boundaries of what is currently known about cancer. By fostering collaboration and supporting innovative ideas, the global community can accelerate the pace of discovery and bring new treatments to those in need more quickly. In addition to advancing scientific knowledge, this breakthrough serves as a testament to the resilience of the human spirit. It reminds us that even in the face of seemingly insurmountable odds, progress is possible. Each step forward in the fight against cancer is a victory not just for science but for humanity as a whole. As more people benefit from these advancements, the collective burden of cancer begins to lift, allowing individuals and communities to thrive once again. Ultimately, this breakthrough represents more than just a medical milestone. It symbolizes a shift in how we approach cancer treatment. By moving away from one-size-fits-all solutions and embracing personalized, targeted therapies, we are entering a new era of medicine where the needs of the individual take center stage. This approach not only improves outcomes but also restores dignity and agency to those battling cancer. It is a reminder that the future of healthcare lies in understanding the intricacies of the human body and using that knowledge to create treatments that are as unique as the people they serve. As the world continues to grapple with the challenges posed by cancer, stories like this offer a beacon of hope. They remind us that even the most daunting obstacles can be overcome through perseverance, innovation, and a commitment to improving the human condition. While there is still much work to be done, the progress made thus far gives us reason to believe that a world free from the fear of cancer is within reach. Until then, breakthroughs like this immunotherapy serve as a powerful reminder of the incredible potential of science to transform lives and redefine what is possible. This breakthrough in cancer treatment is more than just a scientific milestone. It's a beacon of hope for patients and their families around the world. By harnessing the power of the immune system and targeting tumors with precision, researchers are proving that the future of medicine is brighter than ever. If you or someone you know has been impacted by cancer, this story is a reminder to stay informed, ask questions, and never lose hope. Make sure to like, share, and subscribe to stay updated on groundbreaking discoveries like this one. Together, we can spread awareness and support the fight against cancer. Thank you for watching.